Hello, and welcome to today's webinar on neonatal abstinence syndrome. My name is Angela McGee, and I am the Neonatal Abstinence Syndrome Coordinator for the Sullivan County Regional Health Department. A little bit about myself. I've been with the health department going on 15 years. I've always had roles in a health education type positions. I've been Community Services Director over our health education programs as well. Recently, I took the NAS position about a year and a half ago and have enjoyed being back out in the field and getting to work with clients. So today we'll go ahead and get started on neonatal abstinence syndrome. So, what is neonatal abstinence syndrome, or NAS? It occurs when a baby is born dependent on legally prescribed or illegally obtained drugs used by the mother during her pregnancy. So there are different types of classes of substance that the mother could possibly take when she is pregnant: opioids, antidepressants, and barbiturates. Barbiturates are used for anxiety, insomnia, and some seizure disorders. So what causes NAS? Most prescription medications and/or illegal drugs, as well as other substance, pass from the mother's bloodstream to the placenta to the baby during pregnancy. Now, some of these illegal substance or prescribed substance that cause dependence and addiction in the mother can also cause the baby to become dependent. When the baby is born, the supply of drugs that the mother took during pregnancy is cut off. When the supply is cut off, the baby's central nervous system becomes overstimulated. This is what causes the withdrawals to start. Withdrawals usually start within 24 to 48 hours after birth. So let's talk about some withdrawal symptoms of NAS. The baby can exhibit high-pitched cry and excessive crying. Very inconsolable, so it's very hard to, put the baby at ease. The babies will have difficulty sleeping, jerks, tremors, or shakes, fast breathing or excessive breathing, excessive sneezing, frantic, uncoordinated sucking leading to difficulty feeding, and severe cases, vomiting, diarrhea, and seizures. So once the baby is born and it starts to exhibit these withdrawal symptoms, the nurses and/or doctors use a scale called the Finnegan scale, and it has these withdrawal symptoms on the scale. And the nurses will evaluate the baby every 2 to 4 hours for about a 24-hour period and rate the symptoms. Once the baby reaches a 8 to 10 on the Finnegan scale, then the baby is diagnosed with NAS. Also, when mom delivers, they go by the history or background of the mother and also do a drug test for baby and mom. So how do we treat NAS and the symptoms? Well, there's 2 pathways. So for moderate symptoms, the mom is to room in 5 days with baby. So that means the baby's in the room, the mom stays in the hospital for 5 days or is encouraged to stay. Skin-to-skin contact, dim, quiet room, swaddling, and breastfeeding are ways to ease the withdrawal symptoms. Now, the more severe pathway, the baby unfortunately is relocated to the NICU, and they treat the symptoms with opioid replacement therapy. So that means they'll either, in small increments, do doses of morphine or methadone. NAS may not stop at withdrawals. So NAS children may have other problems later in life, such as trouble learning, psychological problems, and health problems. It is not yet fully researched the challenges and needs these babies will have as they grow older, but we do have some educational administrators in the school systems telling us that they are seeing a lot of behavioral problems and a lot of developmental delays as well. Not all drug-exposed infants have NAS, but all babies exposed to these substances during pregnancy are at risk of harm. Using more than one substance can make the baby more likely to withdraw. So this is when a mom would use either prescription medication or illegal medication or illicit drugs, and along with that, either drink or smoke tobacco products. So that can make the baby more susceptible to prematurity or low birth weight, which induces the likelihood of withdrawals symptoms for the baby. So how do we prevent NAS? So a little bit about what I do with our NAS program is that I visit MAT clinics, which is medicated assistant therapy, pain management clinics, basically, and I'll share reproductive life plan, birth control options, health department services. I usually talk about Hep A, Hep B, and Hep C and the differences within that. And I also always bring community resources with me to share as well. I also visit women inmates that are in jail. I go to Frontier Health counseling groups, A&D substance use groups, parenting classes. I get referrals from DCS that the mothers are trying to obtain custody back for their children, and I educate them on reproductive life plan, birth control options, health department services, and also help connect them to resources. So as I mentioned before in what I do for NAS, there's two main goals. So one is the reproductive life plan. So more than half of pregnancies in Tennessee are unintended or unplanned. So that's why a reproductive life plan is very important when it comes to educating moms and sharing this goal. A reproductive life plan lets the mother or young lady or lady think about their life goals, think about how having children fits in with their goals, think about when and under what conditions you want to become pregnant. If you don't want children now or ever, think about how you will prevent pregnancy, and then what steps you can take to be as healthy as you can. The other plan is to educate women about birth control options. And there are birth control options out there called VRLAC, voluntary long-acting reversible contraception. And when we talk about birth control options, I always go from most effective to least effective. And as you see here on the chart, you have an arrow moving upward for more effective. And those more effectives are, of course, your female tubal ligations, a vasectomy for males. And then that's when VRLAC comes into play too, in the more effective tier. because less than one pregnancy per 100 women in 1 year will get pregnant on some form of Verlac, which is a very, very, very small percentage. So for voluntary reversible long-acting contraception, we have your IUD, which is an intrauterine device, and they can last up to 10 years. And we also have an arm implant called Nexplanon, which lasts for 3 years. Our other Verlac voluntary reversible long-acting contraception is our injectable, which is the depot shot. It is about 98% effective because every 3 months the lady has to come back in to get the injectable. These are all effective methods. Your other level of birth control options are your birth control pills, your patch, and your NuvaRing. There also are diaphragms. And then the less effective, so 18 or more pregnancies per 100 women in 1 year, are your male condoms, female condoms, sponge, withdrawal, or spermicides. So again, this is just the more effective to less effective tier. Also, with our family planning services at the health department, we administer IUDs, the Nexplanon, the arm implant, the depot shot, which is the injectable. We do all types of forms of birth control pills. We have the patch and the NuvaRing. And of course, we do disseminate condoms as well to the public if they come in and ask. So now we're going to review some data and a little bit of history about NAS data. So the Tennessee Department of Health made neonatal abstinence syndrome a reportable condition in 2013. This mandates all hospitals throughout the state of Tennessee to report NAS cases. So as you see here in this chart, in 2019, 1% or 808 of live births were diagnosed with NAS. And as you can see too, a slight decrease, that was a slight decrease from about 1.2% of live births, which 949 cases in 2018. As you can see from 2018 to 2019, this is the second consecutive year with a decrease in the number of cases reported since surveillance began in 2013. This slide is rates of cases by region, and it goes from 2015 to 2019. And rates of cases do vary by health region. NAS cases were lower in West Tennessee and increases as you move east. This is because there's a high rate of opioid use is more prevalent in the east region of the state. And also I'll show you this in another graph we will review. But as you can see, again, as we move toward the east, from the west to the east of the state, our rates do get higher. So as you can see in this graph, this is rates of NA cases by county, and it's our rates are per 1,000 live births. So as you can see, Sullivan is in the darkest bluest shade, 45 to 69%. So here's the graph I wanted to talk to you about. And it's mainly due to exposure to sources. So the green part of the bar is prescription medications, which are most common, again, in Sullivan County. When you look at Northeast or Sullivan, the green bar, prescription medications, is more prevalent. On the west end of the state, you will see the blue bar, which is illicit drug use or diverted medications. And diverted means transferring drugs to people that were not prescribed for. So again, this entails us that the west side of the state, high rates of illicit drug use or diverted medications. And as you move toward east, a bigger prevalence and high rates of opioid misuse. And these four graphs just show in figure 13, prevalence of exposure to medication-assisted treatment among NAS cases. Again, as you can see, from East, Knox, Northeast, and Sullivan have high prevalence rates of this. Medication-assisted treatment is where people that have substance misuse go get on prescribed medications from doctors to help control their addictions and make them a more productive citizen in society, where they can function and not have to think about being treated and counseling as well, and not have to think about slipping up or relapsing and things like that. The second chart, or figure 15, is exposure to diverted prescription medications. And again, diverted is when transferring prescription or drugs to people that the prescriptions were not prescribed for. And then in figure 14, this is exposure to legally obtained prescription medications. So again, a very low rate there. And then figure 16 is exposure to illicit drugs. Again, the blue bar is heroin, and then the red bar is other illicit drugs. And you can see in Sullivan County, we are very low in that exposure. So highlights of the calendar year 2019 report. So the number of cases decreased from 949 in 2018 to 808 in 2019. More males were diagnosed with NAS than females. And the rate of cases of NAS decreased from 11.7 in 2018 to 10% per 1,000 live births. Now I want to show you a little video that we created here at the health department about NAS. So I hope this information has been valuable to you. And if you have any questions or know of someone who needs NAS or a reproductive life plan or birth control option education, they can call me and I'll provide that one-on-one. Also, if you need any resources or literature on anything we have as far as NAS, or even as far as any health department service that we have. I hope that you stay well and stay safe, and thank you.